Hi, if you're new here, my name is Kim. I'm a therapist. I've been working in the mental health field for 30 years, been licensed for 25 of those. And today I'm going to talk to you about understanding ADHD. You may also hear ADD, and the subtle difference here is that ADHD includes the hyperactivity part and ADD does not include a hyperactivity part. But today we're going to just talk about ADHD, which in my experience, just on a side note before I get into these slides, is a diagnosis that can be difficult to really see in a presentation. In my experience, when you're sitting with clients in your office, which I'm in private practice, talking about symptoms, some of the symptoms are very similar to a diagnosis of anxiety. And so, a lot of times, having objective testing done is the way to really solidify confirmation of if there's an ADHD diagnosis, an attention deficit diagnosis, or an anxiety diagnosis. I've found this is also especially difficult to tease out in adult women who have presented in my office saying they're anxious. And over time and through some therapy, we start to really recognize that their symptoms are either an attention deficit, not anxiety, and or both. So that's just a side note. Just really clarifying that diagnosis in the field of mental health can be gray and can be subjective and can be tricky. Okay, so attention deficit hyperactivity disorder, or ADHD, is a neurological condition that affects children and adults. There are certainly cases where adults do not understand and or are diagnosed with this mental health disorder. It's either missed in childhood or it's hard to read in childhood. And so it is not uncommon for adults to be diagnosed for the first time. Sometimes people will say to me, well, adults can't be diagnosed. They have to be diagnosed as kids. In my opinion, that's not true. I've had many cases where adults have been diagnosed without a diagnosis existing in their childhood. So it impacts attention, organization, impulse control, and activity levels. It is not necessarily inattention. The way that I describe it, it's a difficulty in determining where to put your attention. So almost like there's too many pathways where your brain is trying to be attentive. And in an ADHD brain, there's difficulty in really figuring out where to put that energy. It's not caused by laziness or lack of intelligence. I've heard a lot of people with ADHD tell me their family and loved ones have said things like, "What is wrong with you?" There's nothing wrong with them. It's their brain chemistry. It's a difference in how brain information is processed and regulates behavior. My husband actually has pretty significant ADHD, and I often say to him, there's nothing wrong with your brain. This is the way that your brain works. And so he and I have really mapped out some strategies in our marriage to help our communication, because trying to understand how an ADHD brain works when you don't have an ADHD brain can be very difficult. So, some common symptoms: difficulty paying attention or staying focused, forgetfulness or disorganization. So, lots of examples of ADHD folks saying things like, "Where's my phone? Where did I put my keys? Where did I put the list?" Even though there's an attempt to be organized and structured, it can be very difficult to be organized and structured, and not because of lack of effort. Restlessness or excessive movement. This is the hyperactive part, when you see or describe or feel like there's an internal battery running and a child or an adult just can't seem to sit still. Impulsive behavior and difficulty waiting. So if you have someone in your life that seems to make a quick decision to do something that would warrant more thought, for example, trading in a car to buy a new car if they're an adult, or skipping school without really thinking about the consequences. I'm trying to give you some examples of things that are impulsive and they really have a hard time waiting. Trouble completing tasks or following instructions. So this one can be really challenging, because for someone without an ADHD brain who is giving 1, 2, or 3 step instructions at a time, the person with an ADHD brain really can only process one step at a time. And so that becomes a challenge. There are 3 different types of ADHD. There's predominantly an inattentive presentation, so trouble focusing, they're easily distracted, they're forgetting, and they have trouble staying organized. For this type, this is often really a problem for the identified person's sense of self. I see a lot of negative self-talk with someone that's predominantly inattentive, because they start to say things like, what is wrong with me? Why can't I stay organized? There starts to be like a train of negative thought, which can lead to other issues. Then you've got predominantly hyperactive and impulsive, which means they're high energy, they're restless, they're impulsive. Um, they they have control challenges, and they act without thinking. So it's kind of like a bright, shiny object. That seems like a good idea. Let me go do that. And so this can be a challenge, because when you're working with someone and trying to get them to slow down and make decisions, it's often true that they cannot. It's not the way that their brain works. And then you've got a combined presentation. So both inattentive and hyperactive, impulsive. This most honestly is the type that I see. I have not seen a lot of purely inattentive or purely hyperactive and impulsive. Most of the time it is a combined type. When you look at treatment options for ADHD, these are not listed in any specific order. This is just the way they're presented here for information. Medication is an option, but for anyone who's got ADHD that works with me, I never tell them that's the only option. When you look at the science in your brain and the neurotransmitters that control your mood, things like serotonin, which is the main mood stabilizing neurotransmitter, things like dopamine, which is the happy hormone, which people with ADHD are predisposed to have less of. When you look at cortisol, which is the stress hormone, when you're looking at an ADHD brain, it is harder for an ADHD brain to regulate those hormones and neurotransmitters in a non-ADHD brain. So for some people, medication is often a life-saving part of treatment. It is significantly helpful, but it doesn't mean that everyone with ADHD needs to be on medication. Therapy and counseling, learning how your brain works, learning to set up systems to help your brain work better, talking about how you feel because of the way that your symptoms are presenting and how they're affecting your daily life and how they're affecting people around you. All of those things are essential for someone with ADHD. And I feel like medication and therapy often go hand in hand, and that's the most effective way for people to feel relief from symptoms of any mental health issue, but especially for ADHD. Coaching and strategies, so kind of piggybacking some of the things that can happen in therapy. What are people going to do in their day-to-day real life to help them set up systems? For example, my husband on our island has a baseball hat sitting where he puts his wallet, he puts his phone, he puts his keys, and he puts whatever he needs to take with him for the next day. He actually puts his medication in the baseball cap in the morning, so he makes sure he takes his medication before he goes to work. So systems and strategies of organization, strategies of how to manage feeling overwhelmed, strategies of how to pay attention and talk to people in your life about how you're feeling overwhelmed is also a key part of treatment for ADHD. Lifestyle changes. As a clinician, I talk a lot with my clients who are managing any sort of emotional health issue about nutrition, protein, how it drives neurotransmitters in your brain, and how that stabilizes your mood, especially for an attention deficit brain. For an attention deficit client, I always talk about the goal of within 60 minutes of waking up, putting 30 to 40 grams of protein in your body, because then you are giving your body the best option for the rest of the day to stabilize your mood and those inattentive parts of your brain chemistry. Exercise, think of it as an outlet for that extra energy to go somewhere so that you're not feeling so overloaded and you're able to kind of offload the extra energy and inattentive, impulsive part of your brain, if that makes sense. Not concretely, that's an abstract idea. Sleep is essential, because if you're not sleeping more than 5 hours a night, and if your sleep is broken, then your brain is not able to reset all of the things I talked about before: dopamine, serotonin, cortisol. I also haven't talked about GABA. GABA is the calming neurotransmitter in your body. So if you're not sleeping well and you have an ADHD brain and you're not eating well and you're not exercising, you are really, I like to use a car analogy. You're trying to drive a car that has a couple of flat tires. So think about it that way. And then mindfulness, support, and brain health. So figuring out how to center yourself, calm yourself down, relax your brain. And then, of course, school or work accommodations can help create an environment. If you have a child that has ADHD, and they can have accommodations around time for tests, around the environment they take a test in, around how their homework is presented. And even for adults in a workspace, understanding that supervisors and HR knows that you have a diagnosis of ADHD and need certain accommodations. We live in a world where that is certainly a real life intervention. ADHD isn't something that has to significantly be defined as a weakness. It's just, like I said, as I explained to my husband, his brain chemistry just works differently than my non-ADHD brain. It's not right, or it's not, and it's not wrong. We just have to understand it, support it, and figure out what treatment works best for the individual, because this is not a one size fits all. If this was helpful, like this post and subscribe. I'm going to keep sharing.